STI test cost. Will insurance cover it? When it comes to getting tested for sexually transmitted infections, many people wonder about the cost and whether insurance will cover it. Understanding this can help you prepare better for your testing experience. Most health insurance plans, including private insurance and Medicaid, generally cover STI testing, often with minimal or no out-of-pocket cost to you. This coverage is largely due to federal laws like the Affordable Care Act, which mandates that most insurance plans cover preventive services, including STI screenings, without cost-sharing when recommended by recognized authorities. So what does this mean for you? Under the Affordable Care Act, most private health insurance plans and Medicaid expansion programs must cover STI screening, diagnosis, and treatment as preventive services. This includes tests for common STIs like HIV, chlamydia, gonorrhea, syphilis, and hepatitis B and C. These services are typically covered without co-payments or deductibles when provided by an in-network provider as part of recommended preventive care. It's also important to note that some states have laws reinforcing that insurance companies cannot limit coverage for STI screenings. For example, in California, insurers cannot restrict testing to once per year, especially for individuals at increased risk. They must cover clinically recommended periodic screenings without imposing unlawful restrictions. However, coverage details can vary by insurance plan, state, and provider network. Some plans may require prior authorization or have specific criteria for certain tests. Therefore, it's wise to check your individual insurance policy or consult your healthcare provider to understand your coverage. If you don't have insurance or your plan does not cover STI testing, costs can vary widely depending on the type of test and where you go. Urgent care centers, clinics, and public health departments may offer testing at reduced costs or on a sliding scale based on income. In recent years, telehealth services have become more popular, and many insurers now cover these services. This means you can have consultations and even access home testing kits, making it easier to get tested without barriers. Medicaid programs typically cover STI testing and treatment, often at no cost to you. Additionally, some states have specific programs that provide family planning and STI services with broad coverage. In summary, if you have health insurance, especially under Affordable Care Act compliant plans or Medicaid, STI testing is usually covered as a preventive service without extra cost, provided it is medically appropriate and done through in-network providers. Always verify your coverage specifics with your insurer and healthcare provider before testing to avoid unexpected charges. Regular STI testing is an essential part of maintaining sexual health, helping in early detection and treatment, which reduces the spread and complications of infections.